Hello, I'm Dr. Maria Yousaf. How are you doing? Uh, Today, the topic that I'm going to discuss is actually a new, rather, it's an old invention by Dr. Anthony Viazzi's, but I am basically a provider for the technology which is called fast braces technology in Pakistan. And I'm introducing the product to you so that you come to know the importance of fast braces and the difference that is there, which is present when it comes to conventional braces, the difference between conventional braces and fast braces. As you very well know, that whenever we put up brackets, bands, wires, normally it takes we have to call you for, let's say, about for monthly visits there, and the treatment can vary from a year to 2 years, 8 months, 1.5 year, depending upon the complexity of the case there. And then once you're done, you have to wear the retainers. We call them, either we give you Holly's retainers or we give you VRFs, where you're supposed to wear these clear trays, or wire which is held within an acrylic base, and you need to wear them for some time to stabilize the results. Here, when we come towards fast braces, then the difference is that Dr. Anthony Viazzi's, who belongs to USA, he worked towards the solution where we imitate the eruptive movements. Every tooth which is malaligned has been halted somewhere along the line where it could not erupt fully. So it's just a very simple technology where we work with one wire and a set of brackets. There are no bands there which we use, and we simply put them up to induce slow controlled movements where the teeth are brought in alignment, and it takes about the same time as a normal tooth to erupt, which is about 120 days. So an average treatment which takes 120 days, as I told you, could vary from 100 to 150 days depending upon the complexity of the case. We do not require any retainers. We do not require any retainers. Neither do we require any rigid fixation. Only your incisors might require a slight lingual wire bonding, where, since there is a gap between the upper and lower incisors, that's the only reason. And we can very easily omit that also if we don't require it. Other than that, the bone itself grows. For once we induce the eruptive movements, there is growth in bone, the volume of the bone increases, and the tooth moves in the space where there is induction of bone, and then the bone itself stabilizes the movement. So we do not require any form of retainers at the end. So let's say the main difference is that within 100 to 150 days, any sort of treatment can be orthodontic treatment. We can achieve results for any sort of malalignment there. Only the skeletal discrepancies where surgical treatment is required cannot be met with. We directly order the brackets and the wires from Dr. Anthony Viazzi's, from Fast Braces labs there, and we give you the product over here. We show you the results,